Hello everybody, I'm Shalini Kanagasingam and I'm representing the ESE Communications Committee, and today I'm really privileged to have with us Associate Professor Maria Pigg, who is from the Endodontics Department of the Malmö University in Sweden. So Maria, thank you for joining us today.
Hi Shalini and everyone, thank you so much for inviting me.
Yeah, we're really good to have to speak to you today actually. We're getting a little bit of insight before we attend your lecture tomorrow. So can we start off, Maria, with talking about this conundrum which all dentists will face, one day on the clinic, trying to differentiate between odontogenic versus non-odontogenic pain. Can you give us some tips on what you think is the best ways to look out for these conditions?
Yeah, this is really a complex question, of course, but I think that we as a dentist and endodontists in particular, we are very focused on believing that everything that feels like it's coming from a tooth is actually originating from a tooth. And so we are looking at diagnostic signs and symptoms, and we tend to forget that they often overlap between different orofacial pain conditions. So we tend to interpret everything as odontogenic pain. Well, in real life it's not.
Yeah.
So the first thing I think we should really be aware of is that there is a great overlap between TMD pain and odontogenic pain. So it's not at all infrequent that a patient has TMD pain contributing to their dental pain or their tooth pain. So that is something that I think is the most important thing to be aware of as dentists, because the prevalence is high.
And it's to also try to avoid doing endodontic treatment that is not necessary, because we've experienced seeing patients who've had multiple root canal treatments and that hasn't solved their pain or resolved slightly, and then actually, like you said, there's that overlapping other conditions as well. So you went into other sources of orofacial pain. So can we go a little bit into TMD? So what are the signs you look out for someone who might be actually experiencing TMD?
It's a really good thing that you ask, because there are screening procedures that are available. For example, there's a screening instrument saying that you can ask some very simple questions to the patient. And the first one would be if they've experienced pain from the face or jaws or the temples for the last week or the last month. And if so, how frequent it is. Because if it's continuous, we could probably expect that that could be a TMD problem. The second thing is whether it's exacerbated on movement, for example, opening the jaw or chewing. So that is something also that we should look out for.
When you talk about management of conditions like this, what are maybe something that, again, every dentist can actually do that's conservative, that can be done, and advice that can be done to patients chairside?
If we're talking about TMD, you mean?
TMD, please, yeah.
Well, TMD is the treatment is often multimodal, because since the pain is often complex and we don't know the exact mechanisms, but self-care is really important, that we teach the patient to avoid behaviors that exacerbate the pain, like clenching, for example, and also teaching the patients how to relax their muscles, because muscle tension seems to be a really big factor in the whole thing.
Right. So besides TMD then, what other, well, we say common, but these orofacial pain conditions may not be as common, but what do you normally see, besides TMD, that other origins of neuropathic pain in your patients?
In my university practice, I see quite a few patients with what we think is neuropathic pain, because it's pain that has the onset after a procedure of some kind, either a trauma or an endodontic treatment or surgery, for example. So that is something that we also need to be aware of, that orofacial pain includes neuropathic pain, and we need to know about that. And one thing you could do as a dentist to identify that is to perform an easy or simple somatosensory examination, where you just test between the sides whether the patient is more or less sensitive to, for example, touch or cold or a pinprick. So you can do that really easily with the instruments you have in the clinic. And if you do find differences between the sides in the face or intraorally, for one or more of those stimuli, what we can say is that there seems to be an abnormal function of the sensory system, and that in turn is a diagnostic criterion for neuropathic pain, actually.
All right, thank you for that. Yeah. Sorry, was there anything else you were going to add to kind of helping our patients with this kind of conditions?
Yeah, not treatment-wise, because that is, I think, too complex. For neuropathic pain, it's often pharmacological treatment, but also together with self-management or coping strategies that you can be taught by cognitive behavioral therapy, for example. So there are a lot of different paths, and usually you don't just do one thing, you need to do more than one thing. But I'm thinking that a really important advice for the dentist is to always look for the source of the pain, which may not be the same as the site of the pain. So this is think source, not site, when you're targeting your treatment. Because if you treat, as you started out by saying, if we do endodontic treatment and it's not an endodontic condition, it's not going to help the patient.
And I think that communication about that as well is so important. For us to, firstly, you've already given us some good tips and advice on how to actually identify or at least have a differential diagnosis for these things. But I think we're also ending up in situations where a patient comes to you, being an endodontist, they come to you expecting to have a root canal treatment. So trying to sort of, almost convince them in some ways that they may have something else going on. What is your advice on going about this discussion with the patient?
There are two things that I would like to stress. And the first thing is that we need to be really open in the communication with the patient. We should not be finding ourselves high above them and telling them that this is this and that is that. We could be open with that this is difficult. We are not really trained very well, most of us, to identify orofacial pain. So this is something that we don't encounter every day, so it's really difficult. So the patient is aware that this seems not to be the straightforward problem that they thought it was. Yes, and then the other thing is, if you don't know and you don't know how to proceed, consult with a specialist, with an endodontist if you have one in nearby, or an orofacial pain specialist, because they are the ones that are really trained to do this.
Yes, I think it's important. It's a multidisciplinary team, but for us to identify that and then be able to refer accordingly is so important.
And if you think it's dental pain and you perform endodontic treatment, because that is what we're trained to do, and if it doesn't work out the way you expected it to, then you should always take a step back and think this could be something else. What are my opportunities to use different kinds of methods?
Yeah, thank you. That's very helpful,
I hope.
Maria. Yes.
But it's difficult. I mean, this is not something that any of us think is easy.
Yes, and I think I agree with you. I mean, even dental school or even with postgraduate training, somehow there's a bit of limitation in how much we are trained to recognize these conditions and to manage it as well. And again, not commonly seen in practice, but so important to identify it when it is there. I think my take-home message from our conversation today as well is you stressing source, not just the site, because that can be something that can maybe confuse the diagnosis.
And there's one more thing that I actually like to say is that you should also ask the patient about other chronic pains. If it's only the tooth pain problem, it's more likely to be easy to manage. It's also more easy to be likely to be odontogenic probably. But if it's a chronic condition and you have other chronic pains, this is what to look out for. Because these patients will have different, more complex pain.
And having a more holistic view of their general medical condition, the systemic health.
Outside the tooth and outside the mouth.
And again, being dentists, we want to zoom in. Being endodontists, we want to talk about the root canal. So I think it's so important to have someone like yourself who has that background, obviously, with endodontics, but also focusing us on making sure we see holistically the overall patient view and then identifying some of these really actually tricky to diagnose types of cases.
And it's okay to be uncertain, because we don't really know everything.
Yes, I agree. And then I think also when you're uncertain, like you said, take a step back. Yes. So thank you so much for the tips, Maria. Really helpful to speak to you today. I'm very much looking forward to your lecture tomorrow. So I appreciate that.
I hope you'll enjoy it.
Yes, definitely. So thank you for joining us today. Thank you again to Maria for coming in and giving us all that helpful advice. And we hope to see you soon at a European Society Endodontology conference.